Good morning. I'm Pat Living with the Department of Health and Social Services and your moderator for the COVID-19 update for Tuesday, November 17th. We're joined today by the Yukon Premier, the Honourable Sandy Silver, and the Yukon's Chief Medical Officer of Health, Dr. Brendan Hanley. We are joined as usual by our sign language interpreter Mary Thiessen and André Boursier from French Language Services Directorate. Following our speakers, we will go to the phone lines for questions from reporters. We will call you by name and you will each have 2 questions. Before we begin with our speakers, I would like to verify that everyone can hear us. If any of the reporters are having a problem, please email alexis.miller, M-I-L-L-E-R, at gov.yk.ca. Premier Silver?
Thank you very much, Pat. Hello, everybody, and thank you for joining us here on the traditional territory of the Kwanlin Dun and the Ta'an Quechin Council. I'm very pleased to be here again with Dr. Hanley to provide an update on government's response to COVID-19. Last week, we announced another case here in the territory, bringing our total count to 24. Dr. Hanley has more to say about that in a moment. The new case, combined with the dramatic increase in cases in Nunavut in the past week, is a stark reminder that we are still in the grips of this pandemic and things can change very quickly. Once again, I want to stress how important it is to practice the Safe 6. This is still the best thing that we can all do to keep our territory safe. Washing your hands, maintaining physical distance, staying at home if you're sick, traveling responsibly and respectfully, both inside the territory and outside the territory. Self-isolate as required and also follow gathering guidelines that are in place. By practicing the Safe 6, you can help keep all Yukoners safe. We cannot let our guard down and we must remain vigilant. In the past week, we laid 2 additional charges under the Civil Emergency Measures Act, both for failing to self-isolate as required. This is disappointing. As I've said before, self-isolating is not a suggestion, and it's not something that you can choose to ignore if it's inconvenient. The self-isolating requirements are in place to prevent the spread of COVID-19 in our territory. It's for everyone. If you fail to self-isolate, you put your friends, your neighbours, your colleagues, and fellow Yukoners at risk. Canada's second wave of COVID-19 is reaching the territories, and we need to make sure that we're doing everything we can to protect our communities. It is also important that we support our communities. With a case of COVID-19, when a case of COVID-19 is detected in the territory, Dr. Hanley and his team, together with the Yukon Communicable Disease Control Centre, put in an awful lot of hard work determining the level of public risk associated with the case. They provide the public with the information needed to help mitigate the risk and to allow people to act in a way to minimize the spread of the disease. And they provide this information as quickly as they possibly can. When this happens, it's not a time to shame people who have tested positive, and it's not a time to treat entire communities as though they are dangerous and need to be avoided. I know it's difficult, and it was difficult, for example, with my community of Dawson, when we were advised this summer to self-monitor due to possible exposures. And I know how difficult it has been for the good people of Watson Lake, following the cluster of cases in that community just a few weeks ago. But we cannot stigmatize Yukoners in a community. We need to support them, and we need to be kind. We're all Yukoners, and we're all in this together. It is fine to ask people and to encourage them to practice Safe 6, but please do not do that in a disrespectful manner. We still need to be strong and caring together, because that's how we're going to get through this. Being kind and respectful and patient, well, those are essential qualities of Yukoners. And when we're dealing with each other, and also when we're dealing with people in our workspaces, in public spaces throughout the territory. One example as well is masks. Masks are now required at the Canada Game Centre and at some places of business as well. It's important to respect the requests of businesses and organizations to wear masks. These policies are precautionary measures that are meant to protect the health and safety of Yukoners. No one wants to move backwards when it comes to restrictions or phases, and the best way to prevent this is by everybody doing their part. It's also vital to be properly informed of what is happening in our territory and what we can do to individually keep Yukoners safe. Rumors can spread more quickly than the disease, and they can cause unnecessary panic, distrust, and resentment. So again, I encourage all Yukoners, please stay informed about COVID-19. Accurate, up-to-date information about Yukon's current situation is always available at yukon.ca. This is where you're going to find out about active cases and the risk, if any, to the public. We will continue to share information as it becomes available and keep you informed about what's happening in the territory. These weekly briefings are also an important source of accurate information, so I really do appreciate you all tuning in for these updates. Thank you very much for that. There has been some encouraging news recently in terms of promising vaccine trials. As many Yukoners are aware, the delivery of a vaccine is the final piece, so we need to fully that we'll need to put in to fully ease the restrictions. So, like people all around the globe, we are anxiously anticipating an approval of a vaccine. We want to assure Yukoners also that I am in regular conversations with my provincial colleagues, the premiers in other territories and provinces, and also the Prime Minister, discussing a coordinated national response to the pandemic. We're working closely with our federal counterparts to prepare for the vaccine as well. Plans for the territory are already underway. This includes identifying storage space, the number of required doses, staff requirements, and plans for distribution. This is being informed. This is being informed by this year's flu vaccine rollout as well. During this first few weeks of the flu campaign, 10,830 Yukoners received their flu shot. Now that's compared to 11,864 Yukoners for the complete year last year. So that's very impressive. Thank you, Yukoners. Big thank you to all those who have gone out and got their flu shot already. And a reminder that to those who haven't got the shot yet, it's still available. You can find information about where to get the flu shot at yukon.ca as well. Thank you, everybody, for listening to my part of the update. Dr. Hanley, off to you.
Thank you, Mr. Premier. And bonjour, good morning, everyone. I'm going to cover many of the same topics that the Premier just covered, with a little more detail from a public health point of view. Even for those of us immersed daily in things COVID, this has been an unusual week. Cases surging around the country, our friends in Nunavut experiencing their own surge, Manitoba seeing hospital beds fill up, the United States hitting new records daily, and many European countries facing huge second waves. From our viewpoint, it almost seems like we're in the eye of some huge global COVID cyclone. I certainly understand the stress and anxiety this is causing for us, especially as there's little news at the moment that is not COVID-related. Indeed, even while we're in the Yukon, we're doing well. We're all deeply connected to this country as we face crisis levels of COVID in so many regions. If you have been following the case count on yukon.ca, you will have seen that our number has increased by one, as the Premier said, as we announced our 24th case last week. And like all others, this case was related to travel outside of the territory. In this case, even though the individual did everything right in terms of getting tested and self-isolating, there were those potential exposures to the public just prior to symptom onset, which led to the notifications that were posted at the end of last week. Contact tracing is still being carried out with some testing of contacts, and it is possible we'll see further cases associated with this case. Those who are at the locations described in the public notification are asked to self-monitor for symptoms, and if you are feeling ill, even slightly feeling under the weather, please arrange for testing and advise the testing center that you are present at one of those locations. In this case, the individual in the case number 24 is doing well. And while we do While this is our 24th Yukon case, we do have an additional recent case in Yukon that will not be attributed to our case count. And this individual is someone from another part of Canada who tested positive up here, is self-isolating and recovering well. Contact tracing again has been carried out with some testing of higher risk contacts, and there are no identified cases linked to this one. And this is an important reminder that Canadians who are not Yukon residents are not counted in our Yukon tallies, but rather in the tallies of their province or territory of origin. We've had only occasional, even rare cases like this. And when there is no public exposure or risk identified, we continue to quietly follow up on these cases and carry out the necessary contact tracing. Whether cases are Yukoners or outsiders, we remain fortunate that all our cases to date are linked to travel, and we continue to have no evidence of community spread. It's indeed distressing to look around the country and see how COVID is surging in so many of the provinces, and now has even struck Nunavut with the outbreak in Arviat. When we look outside, we can certainly take solace in how well we're doing in comparison, but we can also learn from these experiences how susceptible we remain to similar explosions of COVID that could occur at any time. We also see that BC is struggling to contain cases, especially in the Lower Mainland. This BC surge carries an important responsibility for us Yukoners who are sharing in the BC bubble. We must respect the travel orders and the other public health orders that Dr. Henry is putting in place at this time. Be reminded that there is in place in BC a public health order limiting travel in and out of the Lower Mainland to essential travel only. If you have plans to visit the Lower Mainland this week or next, you should seriously reconsider the timing and evaluate whether your travel is essential or not. Be aware also, if you do travel, of the other orders currently in place in the Lower Mainland, particularly around restricting gatherings to household members only. Before you travel to anywhere in BC, you need to take the proper precautions and make sure you're following the orders imposed while you are visiting. And while we maintain our bubble with BC, I want to continue to stress that folks who return maintain that low profile I've asked for before and self-monitor for 14 days after returning. That's why I strongly caution travelers to lay low, and while in BC to follow all those rules laid out. No one wants to be the one who brings it home. I know these last few weeks have been draining as we follow events around the country, as well as dealing with recent events here. We have dealt with many emotional ups and downs here in Yukon, and as we see what's going on in other provinces and even territories, it's hard not to feel discouraged. But we have to keep in mind that there is much that is still under our control. Every day, it is up to us to decide on actions that can either perpetuate fear or make a positive impact on community togetherness and solidarity. We are a community that is held together by its vibrant and welcoming people, and we need to consider that when we ourselves may be frightened. We have had 2 recent public community exposure notices, and we likely will have others. Public exposures have put residents into a vulnerable position of being harshly judged and even feared by their peers. Any of the public notifications we have put out have been low risk and precautionary, ensuring that there was no inadvertent public exposure. None of these public notifications to date has resulted in further positive cases. Any of the contacts that we've seen that have been identified as COVID positive have been high-risk, symptomatic contacts identified through rigorous contact tracing. Remember, we are staying on top of these situations. Through YCDC, contacts of cases are identified and notified promptly, and this process has helped to prevent us from getting into larger outbreaks or ongoing transmission. I've heard of numerous incidents that have included customers being turned away, visitors being told to go home, and individuals being told not to participate in organized events. That's not how we treat our fellow community members. This is a time for caution and vigilance, yes, but with a good tincture of kindness, acts driven by empathy and not fear. COVID is unavoidable. We have seen now in several parts of the country where even tight border controls have not kept COVID out. It is like the virus is always there, like frigid winter air, looking for its way into a warm house. We need to accept that COVID is part of our lives right now. If we take the right precautions, avoid large gatherings, maintain our social bubble and safe distancing measures, wearing a mask when it's appropriate, we are protecting ourselves as best we can. And that's all we can do at this point. I ask that you don't avoid or ostracize your fellow community members out of fear of contracting COVID. We are in this together. As soon as we begin refusing to help one another, we weaken as a community. Many weeks ago, I talked about fear and brought up that Arabian proverb, "When danger approaches, sing to it." We can't run away from COVID. We can't lock it outside our doors. We must integrate this danger in our lives, live our lives as fully as we can with the present constraints, respect the threat, and meet it with the safety measures that we have learned are effective. This leads me into the issue of misinformation that the Premier also mentioned and the many rumors that have been spreading. And as the CMOH, I ask that each and every one of you check yukon.ca as your first point of information. We keep this up to date, and any new information regarding cases or exposure notices will be there. The spread of misinformation causes panic and fear that is unwarranted. It is incredibly important to ensure the source you're receiving your information from is legitimate. Living in a small territory, information spreads quickly, and as it spreads, it can move even further from the truth. We need to be careful before we communicate to others what we've heard through the grapevine. COVID rumors can be damaging to morale and to our trust in public health. When in doubt, listen to these press conferences. Check the Government of Yukon's social media and website for any information regarding COVID. In the last week, there have been many updates about the progress of vaccinations for COVID-19, and we're all excited about the recent Moderna announcement and look forward to more details on these two messenger RNA vaccines and others to come down the pipeline. I'm receiving many great questions about vaccine development and availability, but as we work through the initial preparations for receiving vaccine, we too only have so many answers at this time. As the first two products continue through Phase 3 trials, the next steps will be Health Canada approval and then potential allocation around the country based on a prioritization process. Vaccine availability will continue to increase through next year. And the way things are looking so far, I think we can all look forward to receiving vaccine sometime in 2021. For our loved ones in long-term care facilities, COVID-19 has undeniably taken hold of many facilities across the country and throughout the world. It's been a trying time which for many months has left us without the opportunity to socialize and check in on our loved ones like we did just months ago. Our long-term care facilities have been doing a fantastic job here in the Territory. Following the guidelines and strict protocols, staff continue to go above and beyond for residents. Because all our facilities are publicly owned, we are in an advantageous position compared to other parts of the country. While some facilities are having to increase restrictions, we can let up a little and again look for some rebalancing of the risk. Residents will now be able to designate 2 additional family or friends to be added to their visitor list to expand the number of people they can see. I know there are many who will welcome this change. It's that time of year also when we would typically begin to line up our weekends to visit 1 or 2 craft fairs and stock up on gifts for our family and friends from local artisans. Craft fairs are events that brighten everyone's spirit. In previous years, we filled through hallways of community centres or the old fire hall. However, we all know that this year will not be the case. Many craft fairs have submitted operational plans, and we have been happy to approve them. The level of detail and care being taken to protect patrons while allowing the events to carry on has been very impressive. We should show our support to our local entrepreneurs and visit the craft fairs this year, but we need to do so by strictly following the public health measures being set out to keep these events safe. If you are feeling sick, please do not go to any public event. Have a friend or family member FaceTime you with the local crafts. If you want to purchase gifts, do so virtually. Wash your hands while there frequently and carry hand sanitizer with you that has at least 60% alcohol. Maintain distancing of at least 2 meters between yourself and other patrons. Wear a mask in any setting where physical distancing may be difficult and whenever you are asked to do so. Remember, to everyone planning to visit one of the craft fairs, be cautious, use your best judgment and your common sense. As we dip into colder weather this week, we bring out skis and snowshoes and machines and spend as much time outdoors as weather permits. I know that we typically would be spending more time indoors, but it's known that there is a higher risk of COVID-19 transmission in closed and indoor settings. As the winter months continue to keep encouraging us outside, we will be releasing COVID-19 guidelines specific to winter activities. Outdoor activities are relatively low risk, but still always be aware and maintain your distance and your vigilance. Again, if you are sick, don't go outside and mix. Instead, get tested, stay home, stay isolated from others, rest up and stay warm. And finally, I am in conversation with government about potential masking policies for the territory for enclosed public spaces. I know and see that more and more people are using masks in public settings. We know that evidence of effect is accumulating, as is practical experience in implementation of policies in various parts of Canada and the world. I know there is public readiness for direction in this regard. So I do implore you to acquire a non-medical mask if you haven't gotten one already, or a few, and get used to using masks in public settings, especially when asked to or required to by the business, and when there is any concern that physical distancing may not be observed or possible. We are currently exploring all the implications that masking policies may have for individuals, communities, and businesses. And that's all for my update. Thank you. Remember to take care of each other, to stay well. Thank you. Merci. Merci, Joe.
Thank you, Premier Silver. Thank you, Dr. Hanley. We'll go now to the phone lines, and we'll begin with John from CKRW.
Hi, Dr. Hanley. You say that wearing a mask is recommended where physical distancing may be difficult or near impossible. And if you've been around town, you know that most businesses, it is physically impossible to properly distance out. What's preventing you from initiating some sort of non-medical mask mandate now as a form of early direction for the public, seeing as in the winter months we will be going inside more often?
So thanks for that question. The first thing is I want to say that retail spaces and businesses can be set up to allow for proper physical distancing. So I know that this doesn't always occur. We've all seen instances where physical distancing is not respected or not complied with, but that doesn't mean to say that it's not possible. So we have to come back to the basics of the Safe 6 as fundamental requirements before going to the mask question, which is that additional layer of protection. So you can't substitute physical distancing with mask use. We know that that evidence does not support masks in and of themselves as adequate protection against COVID. So masks are that additional layer. So we had to go back to those basics. The second thing is, this is exactly to the point that I was speaking to just at the end of my address, that I'm very interested in this issue. I do think there's, as I say, there's public readiness, but it also, rather than me advising government to do this overnight, there are so many considerations to address before we come out with a mask recommendation, that we want to make sure that we're taking care of all the questions that are going to arise should there be a change towards territorial mask policy.
Do you have a follow-up question, John?
I do. In regards to the booming amount of COVID-19 cases in jurisdictions attached to our bubble here in the territory, I'm wondering what's the outlook on restricting border crossings or any change in restrictions, seeing as we are seeing more frequent cases sort of popping up here in the territory and just within spaces where we wouldn't have to self-isolate upon return, such as BC or the territories?
Yeah, it's an important question, and one that we need to maintain a transparency and to keep revisiting. And this is something that I am certainly concerned about, and talking very closely with Minister Stryker and with the Premier about where we should or could go with our borders. I think it's an important conversation, but I think there are also a few really key points to keep in mind with that as we look at the evidence. One is that, as I was saying last week, if we look at importation risk from BC, even as cases go up, the importation risk has not changed as much as we might think, because the number of travelers has gone down. So it's not an automatic that we are amplifying greatly our importation risk. The other thing is that our cases, if we look at origin of cases, we have not had a documented Yukon case that has been directly related to the BC bubble. So we've had cases that have had nothing to do with the BC bubble, that have, as even ones that we've recently announced, that have been associated with travel outside the bubble. So I think we need to be careful about the assumptions that we're making about origins of cases. The third thing is that if we look around the country, we are seeing, even in, and again, I mentioned this in my notes, but even in places with some of the strictest border requirements, we are seeing cases come up and spread. And I'll give two examples. One is Nunavut, which has had the strictest quarantine measures in the country, and now, as we all know, and are watching closely with our friends in Nunavut, they are seeing community spread in one community in Arviat. Manitoba is another example where they have had 2-week isolation orders for people coming into the province from outside, and now they have the highest per capita rate in the country. So I want to try to de-link a little bit of that association with just looking at the borders and not looking at how we prevent spread. So to me, I think it's much more important wherever we go with quarantine as a territory, quarantine requirements, whether more open or more closed. The critical thing is what we do to prevent transmission, how we prevent cases from becoming outbreaks, how we prevent outbreaks from becoming large outbreaks or multiple outbreaks or turning into community transmission. So it really all comes back to us.
Premier Silver?
Yeah, I think that's a great synopsis of all of the things we need to consider. But I would say that when it comes to regions that we've already opened up, like BC, for example, we could have certain sections of provinces revert if we felt that there was a problem. So we are monitoring the current situation, but let's say any specific area of BC becomes a concern, we could require 14 days self-isolation for people coming from those specific regions as opposed to a province-by-province consideration. But I completely agree with Dr. Hanley on the current situation when it comes to the Lower Mainland. We are continuing to monitoring their situation in that particular area. John Stryker did share last week as well that in the Legislative Assembly, this week, that our traveling from BC is down this week alone by 15%. So again, it's not just one thing to consider, it's a whole bunch of things to consider, but we could. And this is a good example of, as we look at when a vaccine comes in place and as we get into situations where we are moving forward in our plan forward, the path forward, and the triggers that allow us to go into that next phase, we could be considering the same thing where it's not necessarily a provincial consideration, but we have a regional consideration based upon epidemiology.
Thank you. We'll move now to Claudiane, Radio-Canada.
Oui, pour le docteur Hanley, donc peut-être juste me dire là en français quelles sont les nouvelles mesures que vous annoncez. Vous avez parlé des familles, il y avait autre chose, je pense. Quelles sont les nouvelles mesures que vous annoncez aujourd'hui?
So the question is for Dr. Hanley. Could you please repeat in French what are the new measures that you're putting in place at this point?
Oui, merci. Donc, ce qu'on a annoncé, c'était pour les résidences long terme. Donc, on a ouvert le nombre de visiteurs qu'on est permis. Ça reste pour le moment à 2 personnes, mais on peut maintenant enlargir jusqu'à 4 personnes, donc des amis ou dans la famille, pour être sur la liste pour les visiteurs, pour les résidences long terme. Donc, à part de ça, est-ce que vous avez demandé quelque chose de spécifique?
Vous venez de dire 2 personnes, c'est 2 personnes ou c'est 2 nouvelles familles qu'on peut ajouter à la bulle familiale?
Is it only 2 new people, or are you talking about 2 new families that we can add to the bubble?
Non, ça c'est juste pour les facilités long terme. Donc, on parle seulement, pas pour les situations domestiques, mais pour les visiteurs, pour les facilités comme Whistleband ou Copper Ridge Place. On peut avoir 4 personnes sur la liste de visiteurs au lieu de 2.
Avez-vous une autre question, Claudiane?
Oui. Est-ce que les voyages en Colombie-Britannique non essentiels sont permis?
Are the non-essential travel to BC are permitted, or is there anything changed there?
Oui, merci pour ça. C'est juste pour clarifier que j'ai recommandé fortement qu'on suit les recommandations de Dr. Henry pour limiter les voyages entre la région, les deux autorités de santé, le Fraser Health et Vancouver Coastal, donc effectivement la région Lower Mainland, donc pour avoir les voyages essentiels seulement. Donc c'est important pour les Yukonais qui sont en train de contempler des voyages, de respecter les ordres et les règles, les nouveaux ordres et les nouvelles règles et les recommandations de Colombie-Britannique.
Thank you. We'll move to Gabrielle, Whitehorse Star.
Hi, I'm hoping the Premier can answer how many doses of the vaccine the Yukon will receive.
Yeah, so the quantities located per province and territory has not been established yet. As we're still in the third trials for both companies, the effectiveness based upon those trials will determine a lot of the distribution as well. For example, the latest trials for the Moderna vaccine has been done for elderly patients as well, and it seems that they're starting to see who is it most effective for. So that's going to be a consideration. I'll leave all that up to the science and to the doctors, but suffice to say that the results will determine distribution quite a bit in strategies, maximizing the results by targeting where the vaccines are most effective. Conversations at our level right now with the provinces and territories right now is about distribution and the responsibilities therein of governments.
Dr. Hanley?
I think I agree with the Premier. I mean, it really is too early to say. There will be, I mean, one thing we can be sure of is that there will be enough vaccine for anyone that wants or needs it. But the quantities of each vaccine as it comes through the approval processes and the prioritization that I talked about, that's where we're participating in these national conversations, but we don't have the numbers yet, and we won't for a while until all of those processes are followed. But we are already getting to work on looking at all of the logistical considerations for receiving and distributing vaccine in the coming year.
Thank you. A follow-up question, Gabrielle?
Yeah, I'm wondering if there's a plan for phasing into the stage of vaccine availability. So our reopening plan kind of, it halts at this phase where the vaccine is available. It's like a green light and good to go. And I'm assuming that it's not really going to work like that. It's going to be a bit of a slower process.
Yeah, sure. Yeah, absolutely. That's a great question. And again, that's part of. I think that's the blanks that we'll be filling in as we get closer to that vaccine availability. And again, working with government on the forward path forward, because it's certainly not going to be overnight. It's going to be a gradual accumulation of. Well, at least that's what we expect. Is that a gradual accumulation of immunity in the population that would allow us to then consider that kind of gradual return to normal.
Thank you. We'll move to Marine, Aurore Boréale.
Merci. Est-ce que vous m'entendez? Allô?
Oui, allô? Marine, es-tu là? We can hear you, Marine.
OK, merci. Ma première question est un peu un suivi par rapport à la dernière question posée. Vous annoncez un vaccin qui pourrait être disponible en 2021. Comment prévoyez-vous l'implantation de ce vaccin? Est-ce que on prévoit que ce soit un vaccin qui soit obligatoire pour voyager, obligatoire pour rentrer au Yukon? Est-ce qu'il y a déjà un certain niveau légal qui vient avec l'idée de ce vaccin?
We're talking a lot about vaccines. Are there any plans on how the implementation will be made? Is the vaccine going to be compulsory for people coming from outside, for example, or for other people in the Yukon?
Merci. Oui, on va parler beaucoup plus sur les questions de vaccins. C'est pas normal pour nous. C'est pas la pratique normale de rendre les vaccins obligatoire. Donc, normalement, on travaille avec l'encouragement de la population de le passage d'informations le plus détaillé possible et avec tous les conseils qu'on peut donner pour encourager l'immunité de la population. Mais normalement, sans un mandat ou sans une obligation. Donc, c'est la direction que j'imagine on va prendre quand ce sera pas, on n'anticipe pas que ça sera un vaccin obligatoire.
Could you please repeat that in English,
Sure.
Dr. Hanley?
The question was whether we would be asking mandatory vaccination as we see the COVID vaccines, or asking, for instance, travelers coming in to be vaccinated. I think that would be very unlikely. I don't anticipate making vaccines mandatory. We haven't made any other vaccines mandatory. We would be much more likely to be working with just giving you the information as we receive it, giving you the best advice we can, encouraging encouraging the population and ourselves of the advantages of being vaccinated to allow us to for that return to normal. An obligatory vaccine would not be part of that equation.
Thank you. Avez-vous une autre question, Marine?
Oui, merci. C'est une question pour le Dr. Hanley et pour le ministre Sandy Silver qui concerne une annonce que vous avez faite la semaine passée au niveau des étudiants de 10e à 12e année. Beaucoup de parents s'inquiètent sur le fait que l'école n'est pas revenue encore à temps plein pour les étudiants, sachant que beaucoup d'étudiants vivent du stress. Sachant aussi qu'au Yukon, il y a un taux de décrochage scolaire qui est très haut, et qu'il y a aussi un très haut taux de consommation d'alcool chez les jeunes, que le cannabis est très facilement accessible. Les parents sont très inquiets par rapport à ça. En tant que chef médical du Yukon, comment est-ce que vous prenez ces faits-là et la décision de ne pas ramener les étudiants de 10e et 12e année en classe à temps plein? Est-ce que les choses ont été considérées? Comment vous voyez ça pour le futur?
So, given that students in grade 10 and 12 are might be at risk of if they are not in school full time, how do you justify to parents the decision of keeping these students on a part-time basis in school for these higher grades in high school?
So we're at a unique situation in the Yukon in that we do have all of our students back in school, albeit that the grade 10s to 12 are on a part-term schedule. We've had the Minister of Education report back anecdotally of families that are struggling in this situation, but also families that are thriving in this situation. And the most important thing to remember is we're putting in place these guidelines based upon health, based upon the recommendations from the Chief Medical Officer, and making sure that ultimately the number one goal is to keep our students and the custodial staff, the teachers, the parents, everybody safe in this global pandemic situation. And I believe the department is doing a fantastic job in this pursuit. It's not a good year. It's not an easy year. Being a former high school teacher, I can say that in the best of times, high school is a very stressful situation. And add on to that the situation of part-time learning, add on to that COVID-19. These are extremely stressful times. But the department is working with all the stakeholders in education, including parents, school councils, the administration, to make sure that what we do is to first and foremost maximize the safety of our students, but also to do that in a way that we can ensure that the education is happening in the best way possible. Again, by saying that, we do recognize that it's a stressful situation, but I do commend the teachers for being flexible. I commend the students for thinking outside the box, which, again, post-COVID is going to be another tool in your toolbox, post-high school education, being able to be resilient in the face of adversity. And that's something that Yukoners do anyway, and we're seeing it with our students. There are supports for mental health for students. They need to reach out to their counselors and to their teachers for extra support for education as well. There's lots of opportunities to talk with tutors and to make sure that the education system is there for you if you need it to be there for you.
Oui, peut-être je vais ajouter, comme vous avez demandé mon avis aussi, peut-être quelques points pour souligner. Un, c'est une décision du département d'éducation et le ministre de l'Éducation, mais on travaille très prochement avec le département et avec le ministre. C'est aussi, comme le premier a dit, c'est une année difficile, n'importe quelle décision, c'est une année difficile d'aller à l'école pendant une année de COVID. C'est aussi important de souligner que si on a changé pour le deuxième, troisième semestre, ce sera aussi une disruption énorme pour les étudiants qui maintenant ont plus ou moins établi dans une routine. Donc, pour changer la routine, ça pose aussi des risques. Et on a beaucoup de parents, des familles qui sont très satisfaits avec le système qui est maintenant disponible. Donc, la décision de département d'éducation, c'était pour continuer, mais pour appuyer plus pour les besoins, pour servir les besoins des étudiants qui ont besoin plus d'appui. Donc vraiment, c'est pour appliquer plus de ressources pour ces étudiants qui trouvent la situation plus défiante.
Thank you. We'll move now to Beth, Canadian Press. We'll move on then to Haley, Yukon News.
Thank you. I had a question for Dr. Hanley about the situation in Nunavut, and I'm just wondering how closely you're following that, and if there's any lessons to be learned, since as far as population, that territory is more comparable to the Yukon than, say, Ontario or Alberta.
Yeah, a good question. One, of course, it's important for me not to speak to information about Nunavut that's not otherwise publicly available. But as I alluded to in my notes, it's important for us to take lessons wherever we can from what we see in other regions. And I think one of the lessons again is that if we focus solely on borders and self-quarantine measures and entry, and don't pay attention to the rest, we can quickly see problems arise. And to me, that's knowing that Nunavut has had, and for very good reasons, I must say, that they've maintained very strict quarantine measures. But you see that even in the face of those strict quarantine measures, the ability for COVID inadvertently to enter, and then the disruption and the number of cases that can happen just from one or presumably one introduced case. So I don't have detailed information. I do stay in close touch with all of our northern colleagues in the Northwest Territories and Nunavut, as well as as well as Nunatsiavut and Nunavik to some lesser extent. So we remain in close contact and collaboration when we, including weekly teleconferences. So we do exchange information and exchange in quite depth, lessons learned or experiences and what we're learning from experiences, exchanging information. So we have a high level of collaboration. On the other hand, there are, I think, significant differences, of course, in Nunavut having remote, isolated communities that are not connected by road, that are largely Inuit and culturally very uniform in being largely Inuit communities, and of course a vast territory, very different southern connections. Very different transport, very, very different logistical challenges. So although we have a few things in common, such as being large and sparsely populated territories, there are also important differences that factor into both the type of preparations and the COVID responses that you'll see play out differently in the different territories.
Premier Silver?
I reached out to Joe, to Premier Sigavictuq this morning, and the conversations that we've been having over the past 20 some odd Council of Federation conversations, the Premier has really stepped up. You can imagine conversations of premiers right across the country of larger jurisdictions, but Joe has been always very dedicated to having the voice of Nunavut and the territories at those bigger conversations, talking about the unique circumstances, not only just in Nunavut, but all three territories. And so, he's always said, we want to try to avoid this, but we know that might not be possible, and we'll be ready for it because of the vigilance of him and his government and his medical officers as well. So we sent Joe love and support from Yukon this morning. What they're going through now is what we went through when we had our first cases. It's the wake-up call, and we wish them all well, and we know that they too will get through this by following the advice of their medical officers and having their own safe six. And I see Joe's out there on social media right now. Premier Sigavictuq is on social media, doing exactly what he needs to do to make sure that people in his communities are as safe as possible.
Thank you. Haley, do you have a follow-up?
Thank you. Yeah, I just wanted to clarify the second case that isn't counted in our numbers. I just want to clarify, so does that the person's not a resident of the Yukon, will they be returning to their home jurisdiction? They're just a visitor in that case? Just wanted to make sure I understood that.
Yes, that's correct.
Thank you.
To Philippe, CBC. Philippe, can you hear us?
Reducing the requirement for distancing, making masks mandatory in common areas. Are these supposed to be in effect now?
We missed the first part of the question, Philippe. I think you were referring to schools?
Oh, I'm sorry, yes. We've announced an update to the school guidelines earlier this month, and I wonder, are those updated requirements supposed to be in effect now?
So my understanding, we made those recommendations, but we made the recommendations in our guidelines. The guidelines have not actually been finalized yet. So we wanted to give that those after conversations with the Department of Education, we wanted to give that heads up that the mask will be a requirement, moving from a recommendation to a requirement as part of the updated health and safety guidelines. Now, I believe we were we're looking at the actual implementation of that for the new year. I'll have to confirm that for sure. But I think with that, it was not to be intended for overnight, because we realize that this has to be worked through with the school councils into the school operational plans, and again there is this implementation process. But we know that some schools have, of course, already been using masks, and it has depended to different circumstances at different schools, how that recommendation has actually played out according to their operational plans. What we'll anticipate seeing is just a much more uniform application of mask use in common areas in the weeks and months ahead.
Thank you. Follow up, Philippe?
No, thank you.
Thank you very much. That ends the update for today. I'd like to thank everyone for their time. Our next COVID-19 update will take place Tuesday, November 24th at 9:30 a.m.